The statistics were revealed at the opening of the first Africa Health Workforce Investment Forum and launch of the Africa Health Workforce Investment Charter in Windhoek. Resilient and well-functioning health systems are critical to ensure the attainment of the UN Sustainable Development Goals, especially Goal 3 and other health-related SDGs. However, Africa's critical shortage of health workers is said to undermine access to quality health services to its populations. According to a study commissioned by the World Health Organization, Africa has a ratio of 1,55 health workers per 1,000 population. Thus, WHO said is disturbingly below the WHO threshold density of 4,45 health workers per 1,000 population needed to deliver essential health services and achieve universal health coverage. The public health workforce shortage in Africa stems from several factors, including underfunding of health systems by member states, inadequate training capacity, and poor remuneration of health workers. Rapid population growth, international unchecked labor migration, weak governance of the health workforce, lack of career paths, as well as poor retention of health personnel are but some of the challenges.
Addressing this shortage requires a multifaceted approach, including investments in training programs, incentives for health workers to remain in their home countries, and initiatives to attract African professionals in the diaspora back to the continent.
It's for this reason the forum is being held to discuss innovative financing models, policies and planning, retention strategies, technological advancements, and involvement of the private sector in health systems.
It's about what studies are showing us when we invest in the health sector. We have an estimate of 9-to-1 return on investment. This is one of the pieces of evidence I'm using when I'm talking about changing the narrative in the health area in Africa. Indeed, some of you ministers who are here, you know the challenge you are facing when you have to discuss with your colleagues from finance, because they still consider health as a liability.
At the occasion, the Africa Health Workforce Investment Charter, which serves to harmonize and amplify collective efforts towards investing in a robust and effective African health workforce, was also launched.
Amongst other things, the Charter aims to cut Africa's health workforce shortage in half by 2030. This will be achieved by aligning and stimulating sustainable long-term investments in the health workforce across the region to reduce inequalities in access to health workers, especially in rural and underserved areas and in primary healthcare settings. It will also promote the creation of decent jobs and the economic empowerment of women and youth.
The forum, which is attended by about 170 ministerial delegates from 18 African countries, will also provide an opportunity to review progress made in health workforce investment and discuss strategies to protect health workforce budgets aimed at global economic downturn and debt distress. Jelana Fuka, NBC News, Windhoek.